Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Now, for the cervical esophagus is actually a midline structure. So, if this is the neck, the cervical esophagus is actually a midline structure. Okay, and then it deviates to the left of the trachea. This is left and this is right. So, it deviates to the left of the trachea like this, and then it passes into the thoracic inlet through the neck. Okay, so this is cervical esophagus. The trachea will be somewhere here like this. So now it is passing to the left of the trachea like this, and it is uh, going downwards into the thoracic inlet through the neck. Now again at the carina, so this is how it is, and then you will have somewhere here you will have carina. So if I draw this 1 minute. So it begins as a midline structure, and it will go to the left of the trachea like this and goes like this. Okay, now we have, this is the trachea. Okay, now here in the thorax the trachea starts to bifurcate at carina. So over here at the carina again the this um, esophagus will move to the right, and then it flows downwards, it goes downwards like this. Okay, so exactly at the level of the carina it deviates to the right. Okay, why? At the level of carina it deviates to the right mainly for the arch of aorta, because here arch of aorta will be there. So in order to accommodate the arch of aorta, this will uh, deviate to the right. Then followed by that, again at the bronchus, let me draw this again. So if this is the neck, first we have a trachea here. Okay, trachea here. Now this is the esophagus in the midline. At the level of trachea it will first deviate to the left. Okay, this is right. First it deviates to the left, and again we have carina here. Okay, at the level of carina it starts deviating to the right. Okay, now it has deviated to the right, mainly to accommodate the arch of aorta, because here arch of aorta will be there. In order to accommodate it, it will deviate to the right. Now when it goes to the right, again we have the left main stem bronchus will be there. Right, so this bronchus is here, right? So this is the left main stem bronchus. Now it winds around, it winds its way to the back, again led to the left, it goes back to the left through around this left main bronchus, and then it goes straight here. So actually at the level of the left main stem bronchus it is slightly deviated to the left. At the level of left main stem bronchus it again slightly deviated to the left, and it enters the diaphragm through the esophageal hiatus, especially at the level of T10. Okay, then after, right, immediately before entering the abdomen, the esophagus is pushed anteriorly by the thoracic aorta. So the behind the esophagus we have the descending aorta will be there before it enters the diaphragm. Just before entering the diaphragm, the esophagus is pushed forward, and the descending thoracic aorta will be backwards. Okay, this is some type of representation.
thank you and thank you for watching.